Hello, everybody. Welcome to our show called Making Nursing Visible. Today, we have on our show a very dear person to me. I call her Elizabeth Ma'am lovingly. Somebody who has spent almost 3 decades in nursing and healthcare industry. A nurse, a qualitist, an NABH assessor, a great nursing leader, a lecturer, a professor, a very God-fearing person, a loving mother, a wonderful wife. I mean, you name it, I've seen all those qualities in my mom. So, welcome to our show, Elizabeth ma'am. We are here to make nursing visible for everybody, and thank you for being our show opener because you're the one who has taught me to take risks and do something new always. You're the one who introduced me to quality, and this is one more of my endeavor. So, I'm so very happy to have you on my show as the opener. Thank you very much for joining us.
Thank you so much, Pearl. And it's wonderful to know that I am the opening batsman for your endeavor, which is so close to your heart. I know I've been talking about this. I know what this means to me. So thank you for putting me on a lighter note on that hotspot.
Like I said, we'll try and make it fun for you, ma'am.
I'm sure you will, Pearl.
Right. So, yes, like I said, you have already always introduced me to something new and, just asked me to go move on and things will fall in place beautifully. I mean, I was just wondering, where did this quality came from for you? Was it something that was in your childhood? Like, how was your childhood like?
I have very fond memories of my childhood, Pearl. We were a very small, very close-knit family. My father was a businessman. He's no more now. My mother and my brother, and it was me. Um, I think there was so much of warmth in the family. There were so many things that we would keep sharing with one another, help one another to make decisions which were always sat together, thought upon, pondered upon. We would nudge one another to take positive strides in life. Very early on in childhood, I realized, I look at myself, with children of the other age group, I realized, yeah, or every child finds their parents very special, and different. And I found my parents very special and different in the sense that they would never impose values or they would never preach values to you. They would just walk the talk and they would be good role models. So whether it's helping the needy ones, whether it's doing charity, whether it's putting in a lot of hard work at your place of work, whether it's punctuality, if you have to be there at 5 or somewhere, father and mother made it sure that we are there at least 10 minutes early. So those things, respecting elders, respecting people, not because of their designation or because of the bank balance they have, respecting the fact that they are individuals, they are senior to you, and they need to be respected. So these are things that I imbibe just watching them. I grew up watching them with all these values, and it's it's become a fiber in me now, and this is what I do with my children. This is what I give back my children. So yeah, a lot of values that I imbibed during childhood I still can, and I thank my parents for it.
That's amazing to know, ma'am. And I think working with you, I've seen those kind of value systems. Somehow I think that just spreads, and it has all come to us as well. I remember you being a very punctual person, so I remember getting into the change room 10 minutes early and make sure that we are at our desk sharp at 8:30 in the morning. That used to be like a very stressful thing for us, but I guess slowly and gradually, that's what has helped us also to be ready for anything and everything on time and not wait for the last moment. So how did nursing come to you? Like, was it like an informed choice, or was it like you were pushed into it, or was it that something everybody was doing so you got into it?
Yeah, so this is in the early 80s, 80, 85 to be precise. I joined nursing, and those days, career choices were quite limited. We had no access to internet, so we didn't know really what was happening around the world. Career choices were restricted to either you get into medicine or engineering, or you become a teacher, or you get into a bank, or you become a nurse. Very few limited options. And after my 12th standard, I wasn't very sure what to get into. It's just that one of my friends got into SNDT, and she got into nursing, and she started talking to me about nursing. And at that time, my father was very not very much for it. He like a typical businessman. He just wanted me to do my graduation, get married, and settle down somewhere. But I had my mother to support me. She was with me in this decision, and she felt that even before a girl gets married, she needs to be independent financially, no matter what she has in life. So I just followed this friend of mine into SNDT, and I didn't know what I was heading for. The initial few days were a little difficult, but slowly I started liking it, and slowly I started loving this profession. So I ended up in this profession just because somebody spoke to me about it, and I thought, okay, fine. And I was not too sure of the other things that were available at that time. I thought nursing would be a good option. So that's how I ended myself into nursing.
I guess many people share a similar story. I think it's just God who chooses people to get into nursing because they're not sure to get into this field, but they just, I think they just follow the path. So after your BSc nursing, ma'am, how was it? I mean, I know that you've done your master's, and I'm sure there are many other qualifications attached to what all you've done. So can you just tell us a little bit about those?
So I completed my BSc, and uh, we had some very, very, very good teachers, and I think who were excellent role models to us. And after completing my BSc, I had a gap of about 2 years, because 3 years rather, because if I was very clear very early on in life that I have to do my master's. So at that time, there was a requirement that if you have to do your master's, you need minimum 2 years of experience in the clinical area.
Right.
So I was fortunate that out of the 3 years, exactly 50% of the time I could spend in India, another 50% of the time I could spend abroad. So the first 1.5 years, I worked in a corporate hospital in Mumbai. I
Mm-hmm.
got into the ICU actually. So I was an ICU nurse for about 1.5 year. And then I moved on to the Gulf. I was selected for the Bahrain Defense Hospital. And there again, I was in the ICU for 1.5 years. So um, after I completed my master's, uh, I joined academics, and that was about 5 years in all. But during those 5 years, I also got a scholarship to UK, the PN Berry scholarship to UK. And after completing the scholarship period, I came back. While many of them stayed back, I felt I need to come back to my country. So I came back. I continued staying there, and then got into teaching again. And while I was teaching there, I got an opportunity to move to Wokhad Hospital as a nurse educator. I worked as a nurse educator for about 6 months, and then I was literally pushed into taking up the position of a nursing head because my nursing head at that time had left, and they wanted me to take over the responsibility as a chief of nursing. So that's how I ended up as a chief of nursing very early on in life.
And I think I remember that's when probably I joined as a part of it. I remember you interviewing me.
Yes, yes, yeah, yeah.
At that time probably you were the nurse educator, and when I joined, suddenly I see that you've taken up the role of the chief of nursing over there. Yeah, those were wonderful days of my life at that time. I in fact remember an instance when you were my psychiatry teacher, and you had this knack of introducing the topics very beautifully. So I remember this, like we are all sitting in the third year classroom there, and you come in, and then you just suddenly announce that we are going to have a surprise test, and we all were like, I mean, we've never heard of surprise tests in nursing, and you were just standing there and watching all of our faces. And then you said, "All right. So how did it feel?" And we were like, "Everybody shouted, ma'am, are you serious?" And everybody's anxious and everything. And then I said, like, "Okay, so today we are going to talk about anxiety and depression and everything." And we were like, "Oh my god!" But I think that when I realized to get students' attention, that introduction is so very important. And when, as a masters of nursing, when we had the sessions on methods of teaching, I applied that method of yours. So, when I was doing a session, I started taking that cue. And I realized how students, when you make it very interesting right in the beginning, you have like all their attention. So, yeah, like I have learned a lot from you. Ma'am, you shared these wonderful pictures of your nursing school days. I can see a lot of them is a beautiful one of your candle lighting, and that takes me back down to my candle lighting days. But of course, in those days, I think you all had a pinafore with a cap on it, and we we had a
Yes.
different outfit. Yeah, and there are these wonderful pictures also of the community posting. Where was your community posting that time? Was it the same as us in Malvani?
So we had our rural as well as our urban posting, and the urban posting was at Malavani, and the rural posting was at Palghar, and we had some real fun days at Palghar. So when I was looking through those pictures, a lot of very, what should I say? Uh, I feel so connected to my classmates just looking at those pictures, and the times that we spent over there was, I don't think it'll ever come back again, Paul.
Oh yes,
Yeah.
I'm sure. I remember one episode when in Palghar when we were doing the hand pump, trying to push the hand pump and get the water. And you won't believe the top of the hand pump just popped out and landed on somebody's head. I can still remember my friend over there, but luckily nothing happened to her. But yeah, those were the crazy days. But yeah, very very fond memories.
But
Never gonna come.
the community really respected that uniform. Whenever they say
Yeah.
so, we had to go to various padas as they would call it, and some of the
Mhm.
students were lucky that they would get, padas very close by, and some of us had to really walk long distance. And when these people, the community people, would see you, walking through, and those days there were hand carts, the bullock carts. They,
Mhm.
sometimes they would stop us and they'll ask us to get into the hand cart so that they can drop it. Everybody knew where our hostel was. They would drop us, and they would run into the fields and get some cucumbers and some fresh vegetables for us. We don't have to ask. They just say, "No, sister, leke jao," So the nurses were held in so much of high esteem and regard because they knew if they had any health problem, these are the people to run through, and they could bank on us any time of the day, any time of the night. So those were the days at Palghar.
Yeah, I remember. I think that was a legacy that was set by seniors like you because I remember the same things happening to us. Just hop into the bullock cart. I think I have so
Yeah.
many images, pictures of the bullock cart thing when they're dropping us to our hostel. Yeah, I
Yeah.
mean, I don't think the Palgur is still there anymore. I think they go to different place now. But yes, beautiful days. I also see some nice pictures of you where you're into action over there, like an active student on the mic. So, what's about that picture? Can you just tell me about that picture?
Yeah, so I was very actively involved with the SNA. If you
Mm-hmm.
remember, we had a very strong SNA body, and LT College of Nursing would represent everywhere on all whatever platform available. We would just go and start off with
Right.
our performance. So in the third year, I was the class representative for the Student Nursing Association, and the fourth year, I was the president of the unit. So
Mm-hmm.
where we had to, because throughout the year there were various programs starting from welcome party for the freshers. Then we would have a Diwali party, the Christmas party, the gifts to be brought for the staff and the students. Then we would have the farewell party, and then in between sports, fashion shows, you name it, and it was all there. And that was very good because that really helped us. Besides our curriculum, this was the extracurricular activities that we got into, and very early on in life. Now when I look back, very early on in life at LT College, we got this platform where we could, slowly but surely come forward, take hold of the mic. And some of us, it was, a very scary situation to begin with, but then slowly and steadily LT College made sure that they are able to inculcate that level of confidence. By the time you leave as a fourth year student, you are like a complete product. Whether it's the clinical side, whether it is organizing some programs and functions for the hospital or for the college that we were working at. I remember after my MSc when I had to move to Aurangabad for a short time. My husband
Mm-hmm.
got a transfer there, and I had to move to Aurangabad, for about I think 2 years. And
Mm-hmm.
I worked at this hospital, which had just started. The College of Nursing had just started there, and they were having the candle lighting for the first time ever. And it was so easy for me to just get into it and start giving directions and telling them exactly what is it that you want, because over the 4 years we had seen our teachers, how do you walk, how do you carry yourself, how do you sit, how do you stand, how do you turn. It was like ingrained here, and you don't have to really make a checklist or something. And the place that you work, at, they see this value add, the value that you bring. Just besides bringing the curriculum to the students, they are also able to see those extracurricular things that we are able to give to our students. So there's so much that I really owe to our College of Nursing. The focus was not just about finishing off the curriculum, giving some exams, and giving you some marks and passing out. The focus was
Mm.
also to bring out those hidden talents in you. It's up to us how well we utilize that and how well you continue utilizing that in your life later on.
I totally agree with you, ma'am. I remember the candle lighting part when we used to have the practice. I remember how the minutest things, like, in the auditorium, when the chord is pressed on the keyboard, and when you're getting up, how you're supposed to actually sit on the edge of the seat and then get up so that the seat doesn't make noise.
Make a
I mean, I
noise,
think,
yeah.
yeah, the attention to detail was fantastic for
Talking
me.
about it, I just remembered an incident when I was working as a staff nurse in Just Hospital. I was in
Mm-hmm.
the ICU and there was an emergency patient who came in, and the consultant had come, and between the two of us, he was there and I was attending to the patient. And within the next 1 hour, very quickly we managed to, put in an IV line, start the medication, settle the patient. And just before he left, he asked me one question, are you from SNDT? And I had the broadest smile on my face. I said, yes, how did you know that? So he's saying some things need not be told. And I was like, I said, wow. And then that was the most beautiful comment I could hear from, from our people, from the people who work with.
Yeah. That's precisely, ma'am. So, ma'am, what do you think? There has been lots of probably not so good and not so good changes that have happened over the period of time for nursing. Apart from the cab being there and now no cab being there, I'm sure there are a lot of other things that have changed over the period of time. I mean, can you just tell us in a nutshell what are the different things that have happened to nursing, how it has grown over the period of time?
So, when we passed out as staff nurses, as from the transition from a student nurse to a staff nurse, like a novice nurse, um, when we came into the clinical areas, we did have very senior nursing professionals in the ICU. As I said, I was in the ICU, very senior nursing professionals in the ICU who just took charge of you. And sometimes it was good, sometimes it was not very pleasant, but we had a lot of learnings from people who were there in the unit. They
Mhm.
had about 13, 14, 15 years of experience working in the department. The patient would go bad even before the doctors could intubate. I would have these senior nurses just intubating the patients, settling them down. They knew their work like the back of their
Mhm.
hands. And we learned looking at them. We picked up a lot of things just by observing them and just by looking at them. um, Over a period of time, now when I look back, when I look at the type of staff who come into the hospital, um, things have changed in the sense that we have a lot of structured way of giving training and induction to our nurses, which never existed those days. So when I joined uh, Just Look Hospital, I think for the first 1 week we were sent on a rotational basis to various departments. And one fine day, I got this information saying that tomorrow onwards you will be doing night duty in the ICU. And I get into the ICU. It was a CCU, actually, a six-bedded CCU. And I open the door, and what I see in front of me is a patient has crashed, and the cardiologist is attending to the patient. There's just one nurse. There were two nurses in the evening shift, and the night duty nurse. So six patients, and we were two of us. The night duty nurse, the senior nurse, had come, and I was the fourth nurse. And in an emergency, more the hands, the merrier. And I was just standing there lost because I didn't know what to do, what was happening. And the cardiologist looked at me and told me to get a Swan-Ganz catheter, and I didn't even know what it means. I just stood there, and then he said, "Don't just stand there, just get the catheter." And
Mhm.
I didn't know what to do. And luckily for me, I had a very good senior who took charge of the situation and told me, just relax, we'll handle. I think about 2 hours of my first ICU duty was just spent in settling the patient. And then I started crying. I said, "No, I don't think I want to work in the ICU." Because what used to happen is we were just put into the department. I think the assurance for the senior management team was that there are senior nurses who know their stuff well and who will take care of the junior ones.
Mhm.
Currently, what's happening, the definition of senior nurses has changed. So sometimes with this iteration, if you have completed 1 year, we just push the nurses to, take over as a team leader. And
Yeah.
she's just completed 1 year. It's not that she's been in the
Mm-hmm.
system for a very long time. But what is sort of compensating or what is sort of replacing now is a more structured way of induction, a more structured way of orientation. We have preceptors and mentors in every department, so that as soon as a nurse gets into the unit, there's somebody to handle them. And within the department, again, there's a very structured way of introducing them to various procedures, various type of patients, various criticality of patients, which never existed before. So I think
Mm-hmm.
that's the change that we are seeing in the way nursing is getting practiced now. And I was at the Anicon, 2 days over the weekend, and what I'm also realizing that nursing leaders across the industry is taking it on themselves, to pave the way for the junior nurses, encouraging them to ask questions, encouraging them to come up with ideas, and giving them that confidence that we are here for you. Don't worry, we are here for you. Strategizing and thinking about how do we make nurses more comfortable so that our patients are safe, our nurses are safe. So that's the difference that I'm seeing now.
That's the association, which is supporting, empowering the nurses and elevating them to a different level now. Also, ma'am, I think during your younger days, you also had a very prestigious scholarship called as PN Scholarship, which took you to England, and you've shared some nice pictures with me. So, what is PN Scholarship all about? And I think it does exist now also, but people are not aware about it. But what is this all about? Can you tell our audiences what this scholarship is?
Okay, so the PM Perry scholarship to UK was uh, started years ago, and this was open to healthcare professionals only at that time. You have to write, I don't remember, but then you have to write some 150 or 200 words essay to tell them
Mhm.
about why is it that, your candidature should be considered. You get shortlisted on the basis of that. And then we were invited to Delhi, where the head office was. Uh, and we had a panel of doctors at that time. Can't remember, it's really long ago. Who would So there was a personal round of interview, and in the evening there was dinner organized, and the purpose of having the dinner was to see how well you are able to groom yourself, how well you're able to present yourself, how well you're able to carry on conversations with people who you don't know. So on the basis of all this, so you have a clinical part of it that they assess, and they also look at the soft skill part of it. And on the basis of this, you get shortlisted. Once I was selected to go there, and you can choose your area that you would want to practice. And when I got a chance to go to UK for the PN Berry scholarship, I had just completed my master's in mental health nursing, and I decided to
Mhm.
take over. Some time to spend some time in the mental health setup, and I was in for a shock because mental health. So this was in 2000, the turn of the century. I
Mhm.
was in UK. So at that time, it's like 24 years now, even 24 years ago, mental health was so evolved there compared to what we had learned in India. So 2 years on mental health
Mhm.
in during my MSc program, we were sent to various hospitals, including some of the municipal hospitals in Mumbai, plus reputed institutions outside Mumbai. But the level of mental health nursing that happens in UK, I was amazed. I mean, you have
Mhm.
hospitals by diagnosis. So you would have a hospital for schizophrenia, you had a hospital for dementia, you had a hospital for anorexia nervosa, a lot of therapies that we have learned in the textbook. That was something that I could actually see there. And my entire
Mhm.
nursing care for the mentally ill. Actually, I think I really learned a lot in that 1 year, which I couldn't learn much in masters because of our limited facilities that we have for our mental health patients. So that was the exposure that I got there, and I was really thankful because I came back to teaching into mental health as a much better teacher. because I could relate and give them examples of what I had actually seen and of what I had actually had hands-on experience with. So I came back as a much better teacher in mental health nursing after my exposure in the UK, in London to be specific. Um, so yeah, that was about the scholarship that I had to UK.
Mhm. I think thanks to that exposure you got, we all I remember me and my batchmates loving psychiatry and looking forward to your
Yeah.
lectures all the time. It was very interesting to learn, and yeah, like you said, the things that you saw and you could explain to us in a much better way. And honestly speaking, now when I'm here in UK, ma'am, I can see that even today the focus on mental health is so much over here. Who is the gentleman in this image?
Yeah, so there was a panel here who decides on the scholarship, and then you're packed off to London, and then at that age, getting to a place like that, it can be quite scary. So it was this gentleman who was who was the first point of contact for us in London, and he would
Mm-hmm.
help us settle. He would help the Indian students to settle down there in terms of finding the right place for you to stay. He would keep in touch with you periodically to get an update as to how you're progressing during the scholarship period. Some of the festivals where we would feel a little lost, he would invite us over, and basically like a father figure for us. So he's a person to run to in
Yeah.
case you're in trouble.
It was like a very well coordinated thing. I can see some pictures of the
Yes.
of nuns and also our principal, Mrs. Joy Kuti and Parul ma'am over there. I mean, how did they land up over there?
Okay, so when I landed in UK, in London, Madam Joykuti and Miss Parul were already there for, I think they were there for about 2 weeks with the Thames Valley University. SNDT College at that time had some sort of an affiliation with Thames Valley University, and
Mhm.
Thames Valley University, TVU as they would call it, had invited them to just visit the university and have some sort of an exchange program. So that's how Madam was there, and it was good because that was the first time I was really yeah, not really the first time, but I was leaving home, and it nothing like coming to a place and finding some familiar faces to welcome you. So the first 2 weeks I had them for my company.
That was indeed a nice coincidence for you. So looks like nursing has taken you to many places. I've been with you on one of them in Singapore. I also know of the Asian Hospital Management Award where you had gone to pick up an award which you had won at Wokat to Malaysia. How many more countries have you visited?
So I think I'd gone to Japan as well to pick up an award. And besides this, I
Hmm.
think Wokhad had sent me to Boston for 3 weeks because we have our association with Harvard Medical International. And after the second JC, I think, I was sent to just try and understand what systems and processes in the Harvard Medical hospitals were like. And I spent about 3 weeks, and that's where I picked up a lot of good things in terms of the entire nursing governance model, which I was so very impressed that I thought I must come back home and replicate the model here. Besides that, I was also closely working with one of the qualitists. She's a nurse actually, but she's a qualitist, vice president in quality, and there I got to see certain things like the patient safety goals, how do they implement it, how are various committee structures set up. I would sit on some of these committees to understand what are the discussion points that they had, sent to various units to learn, including things like the entire education vertical is being set up. So a lot of exposure that I had in the span of 3 weeks.
So shared nurse governance is something that I've experienced with you. I think it's a very nice model. I know that you have been a core part of NABH accreditation standards, developing the standards, being a part of international accreditations of NABH. I just wanted to know how much in reality do you think these standards help to empower the nurses?
I think NABH has been instrumental in empowering nurses across the country. The other day, when we were at the Anicon, Mr. Girdhar Gyani was there, and he was telling us about how, when he wanted to start the entire accreditation process, he visited some countries and They looked at the entire structure as to what are the things that needs to be put in place, for rolling out the accreditation standards in India. One of the things he spoke about was the team that would go for accreditation. So typically for JCI, you have a physician surveyor, you have a nurse surveyor, and somebody from the administration. And Gyaniji was saying that he was discussing about this, and there was some resistance from the physicians who said that I don't think nurses are prepared for it, and nurses wouldn't fit into it. And he was one person who put his foot down. He said, no, if we are starting it, let's start it the right way. And I think that was like a stepping stone for nurses to come to the forefront. NABH helped because the standards that were designed and that are still designed pushes the organization to put in place, structures, processes, and outcomes. And each of these areas, you will agree that nurses play a very crucial role and a very instrumental role. Whether it is structures in terms of committees being put up, whether it is a structure for emergency codes to be activated, processes, you name the process, and there's no process where nurses are not involved. Looking at outcomes, monitoring outcomes, evaluating them, and then putting in changes so that the outcomes keep getting better. When you look at just the nursing vertical, starting from having a very structured method of patient assessment, reassessment, tools that are being used for assessment, whether it is a pain for assessing pain, whether it is assessing skin. I mean, before NABH, I don't think we had any of these in place. So NABH was instrumental in putting all these things in place, whether it is giving more, tooth and nail for an infection control nurse to speak up and, ensure that there is compliance to infection control protocols in the hospital, with the entire credentialing and privileging process, competency assessment, acuity based staffing. I mean, there's so much that has gone into enhancing the standards. We are at the fifth edition now, and every edition has only got better for the nurses. In addition to this, they also have a certification program which is on nursing excellence. A lot of hospitals in the country is going forward for nursing excellence standards. So all in all, I think NABH was very good and it was instrumental in empowering nurses to what we are today.
I think I can just agree with you being an ABS assessor. I can see that I think people generally say the accreditation is more about nurses than anybody else. There is more, 70% involvement is of the nursing team. If they do well, the accreditation is successful. Ma'am, you've been a great inspiration for me. Anytime I do anything professionally, you always have this thing to say. I'm proud of you, Paula. And I think that's a compliment I always look forward to. It makes me really feel proud of myself. Thanks for doing that many a times. On that note, what are the achievements that you are proud of as a nurse leader? I'm sure there are many of them, but if you could tell us a few of them.
I think my biggest achievement, Pearl, is to see people like you. Um, for me as a leader, what I've always loved doing is nurture and groom the young ones. And when I see that there is a spark in an individual and when there is a potential in an individual, I only act as a catalyst to enhance that growth and bring them up. And today, when I see in Mumbai itself, there are so many people who have trained with me, who have learnt with me, and who are at very good positions. And that's what I consider as my biggest achievement. I think for a teacher, when the student outshines her and outgrows her, I think that's the biggest achievement anybody can have. So
That's quite deep, ma'am. And I really respect for you for that, because I've always seen that when we are at the podium, you standing there looking at us with so much of pride. I think those are the moments that I really cherish. Ma'am, how do you have any personal anecdote to share? Highlighting how the nurses sort of impact patients' life. I'm sure there are many, but anything that comes at the top of your mind.
I remember this incident, when one of our patients got admitted to a hospital with stroke, and this patient's daughter was an anesthetist. And my stroke nurse was constantly in touch with the patient and the family. And one would think, when there is a doctor or nurse in the family, the care component is much easier, and you may not want to spend so much of a time educating them because you take it for granted. No, there's a doctor or there's a nurse, they'll do it. And what was an eye opener for me was one day this patient came into the emergency department because the patient couldn't swallow, and the doctor couldn't actually do a proper swallow test. And in desperation, called up my stroke nurse, and I could see her emotional dependence so much on my stroke nurse, and she had so many questions to ask. She kept blaming herself that she couldn't get in touch with the stroke nurse earlier. And for I think for months, even after discharge, this lady would constantly call up the stroke nurse asking a lot of questions. And that was a time when we sat for discussion. We realized, when it comes to our own ones, whether you're a doctor or whether you're a nurse, you become helpless and you need somebody to depend on. And I shouldn't say I was happy, but I was proud of the fact that my stroke nurse could fit into this gap very well. And she would call her up very frequently to make sure that what she's doing was correct, or even before she initiated something, she would call up to understand whether she's going the right way. Another incident is about the hospital. In the hospital where I was working earlier, we have this oncology nurse, and people call. There was a write-up about her in the newspaper. People call her her patients call her the 3 a.m. friend,
Yeah.
because at 3 o'clock in the morning, also, if the patient had some doubt if the patient was unwell, this girl was there attending calls and making sure that the patient is taken care of. So these are things which make you feel good that yes, people value nursing. People feel that nurses are the go-to person at any point of the day or at any point of the time.
Yeah, I feel, yeah, thanks for sharing that, ma'am. I remember the 3 a.m. Friend article which came in, I think it came in Times of India at that time. I think we need to bring more stories upfront, like this, because nurses play a very, very vital role in recovery of the patient, and anytime that they need somebody to listen to them or ask them something, I think nurses are always at the forefront. It's high time that, everybody else starts realizing this. Right. On that note, we are going to move on to our next section now, called as the rapid fire round. So we're going to quickly ask you some questions, and whatever first thing comes to your mind, we're going to talk about it. Right. So are you ready for this?
Yes, but
All right. Let's go for it then. Okay. So Elizabeth as a psychiatry professor or Elizabeth as a chief nurse?
a chief nurse applying psychiatric principles, because
Okay.
because this is the feedback that I get from my people. I think it's the skills that I have learned as a mental health nurse which makes me a better leader. And my team tells me, you are able to create that. You so just like Madam Joykuti would tell, your care plan has to be individualized. I believe that our approach to every nurse has to be individualized, because each one carries their baggage. And if you're able to identify and able to balance their personal and professional life, they stick on to you. They don't leave you then.
I completely agree with that, ma'am, because I've experienced that. All right, next question. One thing novice nurses need to believe in.
They need to affirm and reaffirm the fact that they are in nursing because it's a call. They are not there just because it's a coincidence. It's a call that they have got. And every day they can make a huge difference in their patient's life that they come across.
That's great. And one thing novice nurses should refrain from doing.
So I'll have two things, Paul, to say. First thing, never give up, because nursing is not easy. It is physically, mentally, emotionally quite draining, especially the first couple of years. So never give up. So the second part of it is no shortcuts, because once they're in the clinical area, the novice nurses, once they're in the clinical area, sometimes they see their nurses taking the seniors taking shortcuts. And I keep telling my nurses, what you do in the first few years of your life becomes a habit, and that stays with the rest of your life. So if you pick up the right things, you become a total professional nurse. If you get into shortcuts, you're doomed for your life. So these are two things that I would like to tell the novice nurses.
That's perfect, ma'am. And one thing you feel that nurse leaders need to do.
They need to walk the talk.
And one thing that they should refrain from doing.
uh, do not talk if you cannot walk the talk.
True, true. I agree. I remember one time where, when we had our JC accreditation, and before that, we had to sort of make sure everything is fine. And I remember you rolling up your sleeves and going, in every CSSD area and sort of picking up the CSSD articles and saying, okay, let me check if there's any expiry. So, yeah, I think you've been a leader whom we've always seen on ground. And I think that helps a lot for the nurses, builds a lot of confidence in them. Right. One line you often repeat when you talk to your nursing team.
Okay, so what I like to tell my nurses is a favorite line, a favorite quote, that patients may forget your name, but they will never forget how you made them feel. And what I tell my nurses is when our patients leave our hospital, let them take good memories about you and about the nursing care that we have given in our hospital.
And that's very true, ma'am. I've seen that, that they don't forget how we made them really feel. I've had one patient after I finished my MSc after 2 years. I came back to work hard, and when I was climbing up the stairs, this guy goes behind, Sister Fernandez. And I'm like, who is this? And he comes around and he says, do you not remember me? I said, I'm sorry, I don't remember you. He says, I underwent CABG 2 years back, and you're the person who told me everything about that procedure. And that really helped me in my recovery. So I completely, go by the thought that you've just praised well. Right. One thing you would do if you had the power to change something as a nurse or as a nurse leader.
So, as a nurse leader, if I could change something, is the entire dilution that's happening in the nursing fraternity today. When I say dilution, dilution begins right from the entire admission process to the quality of teaching that we are having in our nursing colleges. Dilution in terms of the total number of hours that are spent at the patient's bedside. Dilution in terms of the quality of teachers that we have today. Dilution in terms of the entire evaluation process. I was speaking to one of the teachers over the weekend and they're saying, I'm happy to be out of teaching because the dilution is so much that you have to pass the exam. You have to make the students pass the exam, whether they're good at it or they're not very good at it.
Mm.
So dilutions have happened at all paces. Dilution in terms of the bedside practices that we see in the clinical areas. So these are things that I would love to change.
That was quite deep, ma'am. Thank you for that. So yes, so we are at the end of our rapid fire round. So that was awesome. So as we come to the closure of this session, what's your one tip on how we can make nursing more visible?
Yeah, that's your baby, Pearl. Okay, so I think if we have to make nursing visible, we need to move from this victim role to the creator role. And I think we are still sitting on this, oh, poor me, I'm a poor nurse. Nobody recognizes us as partners in healthcare. Nobody is giving us our due. So we have been into that victim role for a very long time. I think what we need to do is now push ourselves into this creator role where we are responsible for creating the brand images. As a nurse, I am responsible for creating my brand image as a nursing head in the organization, as well as a brand image for the nurses working in this organization. And I think if we have to be there are a couple of things which are needed. One is our communication skill. There's a lot that we have to work around the communication skill. It has to be assertive. You may have to be aggressive at times, but yes, definitely you need to be assertive. You need to have zero tolerance to disruptive and rude behavior. I don't think you need to be taking it into your stride. There's no need for people to be rude when you're working as collaborators in healthcare. Uh, the biggest weapon, and this is one thing I tell my nurses, the biggest weapon that you need to have is your knowledge about your subject, knowledge about your patient, knowledge about the drugs. Because if you have that, I don't think anybody can challenge you. And take pride in being a nurse. I don't think you need to be ashamed to say that you are a nurse, because I think it's only a nurse who can bring a difference in the life of a patient. The amount of time that we spend with our patients, nobody else does that. Everybody comes for 10 minutes or 15 minutes and they're out of the department, but it's a nurse who is consistently there with the patient. And believe it, every nurse makes a huge difference. They bring a big impact into the lives of the patient. So, another thing that we will have to do is uh, we have to have dialogues with people, policymakers, people who influence decisions at a higher level. Uh, some of the things that are mushrooming up is the quality of colleges that are coming up, uh, which is again bringing up substandard nursing, where again, because the nursing quality is substandard, we are losing our visibility there. There are shortcuts
Mm,
happening because they feel that if you have to increase the number of nurses, just catch hold of somebody, teach them, put them through this 5 to 6 months of training, give them a nursing uniform, and they are nurses. So we need to ban this quack
mm,
nursing. So I think
mm,
as nurses, if we have to get visibility, you and I are
mhm.
responsible. We need to take up, move forward, and bring about a difference in our profession. Let's not wait for others to give us that respect or give us the due. Just take it, grab it, and move along. I think that's my take.
That's completely, yes, ma'am. And like you rightly said, uh, this is one initiative at NXL that we're trying to do. Not play the victim card anymore, just be creators and, go out and tell the world this is the impact that nursing creates on others. And rightly, this is the show to make nursing more visible across. So, thank you so much for being on the show. It has been a pleasure talking to you always. It has been a pleasure being your student, you being my mentor, professionally and at times personally also. I remember one quote that you told me that have patience and all things are going to fall and fit beautifully. Just do your best. I think that's the thought I'm going to, cherish and live by. So, thank you so much, ma'am, for being on our show. Thank you for being our show opener. And I'm sure we'll make more such episodes which will bring the impact of nursing in the forefront and make people realize that this is a profession, this is a vocation which is here to stay. And when it comes to shortage of nursing, people start being aware of it and make efforts to build the workforce, build the capacity and capability of nurses world across. So thanks a ton.
Thank you so much, Pearl, for having me here. It was fun talking to you, and I went back to, I think, 30 years ago, various phases that you took me through. Enjoyed doing this for you. Thank you so much, Pearl, and
Thank
all
you,
the best
ma'am.
for this venture.
Thank you so much, ma'am. God bless you and have a wonderful day.
Always. You too. Bye bye.